All right, welcome everyone. I am Richard Bressler, Board Chair of the Weinstein Hospice Board of Advisors, having served as Marketing Chair since 2012. I'm a career marketer and community volunteer for Weinstein Hospice. Weinstein Hospice is the palliative and end-of-life component of Jewish Home Life, an organization centered on aging, which provides care for a new age. As the only Jewish not-for-profit hospice in Georgia, we tackle issues of community concern in a series of conversations. We've completed the production of 8 successful Zoom webinars for Weinstein Hospice, all targeted at generating awareness and promoting a conversation among the 45 to 60-year-old population in northern metro Atlanta. The conversations are all available for viewing on the Weinstein Hospice website under Education and Resources. This one will also reside there after completion. After this one, we have 3 more conversations planned in January, March, and May. I will now introduce both speakers, and then we will start with Stacy. We'll have Eliza speak afterwards. Then there is time for answers to your questions. Please put your questions in the Q&A box, and we should get to them all. So Stacy Hanna is an Atlanta native, founder of Graceful Journey Atlanta, and the Dementia team lead for the state of Georgia. She obtained a bachelor's degree in political science from the University of Alabama and a master's degree in education from the University of Georgia. She also is a graduate of the Rosalind Carter Institute of Caregiving and is a certified dementia care practitioner, mentor, coach, and consultant for a positive approach to care. She is trained as an end-of-life doula. She will explain what resources are available in the state of Georgia and give the background on dementia and Alzheimer's disease and other facts about the disease. She will hand off the discussion to Eliza. Eliza Afra is the nurse practitioner for Weinstein Hospice, working under the supervision of Dr. Urshad Syed, medical director. She obtained a BS in sociology from CUNY, a BSN in nursing from GSU, and a master's degree in science in nursing from South University in Savannah. She has considerable clinical experience. She's worked with geriatric patients in a variety of roles. Like Stacy, she's a strong advocate for her patients. In her free time, she spends time with her husband and children and volunteers at her synagogue. Eliza will explain how palliative and hospice can help with a dementia diagnosis. Let's start with Stacy. Stacy?
Thank you, Richard. Good evening. Before we get started, I like to start with this quote by Maya Angelou. I have learned that people will forget what I say, will forget what you say. People will forget what you did. People will never forget how you made them feel. This quote could not be any truer than someone living with brain change. Their words may be gone, their sight diminished, but they still hear. They pick up on your feelings, your anxiety, your emotions, and they will match them. So I just wanted to start off that way. Tonight, we're going to talk about what is dementia. There are several types of dementia. Think of dementia as walking into a shoe store. So the name of the shoe store is Fred's Feet. So you walk into Fred's, that would be the umbrella. And then the different types of shoes, high heels, flats, sneakers, boots, are different types of dementia. So the first type of dementia is Alzheimer's. It is the one that we know the most. Next is vascular dementia, frontotemporal lobe, which is what young onset dementia is. Usually people under 60 get frontotemporal lobe dementia. There is Lewy body dementia, which sometimes is connected to Parkinson's. Sometimes individuals with Parkinson's will have dementia, and it will be Lewy body dementia. And then there's over 100 different types of other dementias. So when someone says, my loved one has dementia or Alzheimer's or something like that, think of Fred's Feet's shoe store. Dementia is just a title. It's just an umbrella. What specific type of dementia only matters as the person is aging, because with certain dementias, medication can be a problem. That's the only reason it matters. Okay, there are 4 truths about dementia, and I know many of you have been to the doctor with your loved one before, your spouse, your partner, your child, and they hand you a paper that says, here's your dementia diagnosis. Come back in 6 months. Now, honestly, what are you supposed to do with that? Let me ask you, has anyone ever told you the 4 truths about dementia? 1, dementia means at least 2 parts of the brain are broken. 2nd, it is a progressive illness. 3rd, it is chronic. It means it's never going away. I'm sure many of you in the audience have chronic diseases, asthma, arthritis, whatever your chronic disease is. Dementia is a chronic progressive disease that will cause a person to die at the end. And the reason it does is because the brain stops talking to the rest of the body. It stops saying, hey, I need food. Hey, I need water. I need these things. So I always encourage individuals living with brain change and their families to embrace life to the fullest, because there's wonderful moments to be had. How do I know if my brain is normal aging or I have dementia? Let me set the record straight. Dementia is not a normal type of aging. It is not. Sure, you forgot why you walked in the room, or you left your keys inside and have to go back to get them. That is normal aging. You are talking to someone and it reminds you of something you were supposed to do earlier that day. That is normal aging. How do you know the difference? The difference is when your brain changes enough that it interferes with your life or your partner's life on a daily basis. That is when you start to question it. There's all different ways to focus on someone whose brain is changing. Maybe they are slower to think about something. What did you do today? And there's a long pause. Or, Mom, did you have breakfast? And there's a long pause. Someone will walk into a room and they know their face, but they cannot remember their name after a long period of time with clues. Sure, I walked into a room the other day and couldn't remember someone's name and saw their face, but it eventually came to me. That is normal. Also, when someone living with brain change hears new information and cannot process it as new information, but tells you a story that happened back in their time or in another period, that is something to look into, to question if the new data does not correlate to the current situation. Not normal. Here's what we talked about. When it interferes in your daily life or their daily life. Unable to initiate a task. So that doesn't mean you're procrastinating and you can't do it. It means that if I give you a task to put this puzzle together and I come back 5 minutes later and you haven't touched the puzzle, that would be a lack of initiation. But if I said, Stacy, hey, put this piece of puzzle in here, and you told me how to do it, that's awesome. I just needed that little reminder. I may not have the energy like I had before. I may do things differently than I did before. Maybe I loved ice cream and I don't like it anymore. Or I liked a certain type of music and I don't like it anymore. Yes. Do our preferences change with age? Yes, of course they do. When it begins to affect your daily life, that's when you notice. And then words, when you try to give someone a cue about what it might be, like, hi, would you like some of this? Water? And they can't even tell you the name of it, that might be a reason to worry about brain change. One of the things I love is the two words parenting versus partnering. If you look at the words very closely, you will notice a difference. Since I can't see any of your hands, I'm going to imagine that you figured out that there is an extra R in partnering. Partnering. Yes, many, I know all of you in this audience had parents, otherwise we wouldn't be here. And they parented us through infanthood and toddler and childhood and teenage years and and they still parent us, right? But you don't need the same kind of parenting now in your life that you did at 5, 15, 25. Neither does your loved one living with brain change. They do not need to be parented. Because I just imagine if I could see the audience, many of you are shaking your heads because the loved one with dementia does not want to be told what to do. Nobody does. Just because their brain is changing does not mean they're not there. Remember, they understand how you make them feel. So if you can partner, if you can do this, if you can do a me, a you, and a we, that is partnering. A me, a you, and a we, that is partnering. Some of the best cared partners I know have strong relationships with the person with brain change. So if you and your parent or you and your spouse have been this way your whole life, don't expect that to change. Maybe you need to bring in a third party or even a different family member to help. People want to feel connected to the person that they're working with. So relationships are huge. If you have that strong foundation, it will make this difficult process easier. Next, why do individuals have challenging reactions? Don't you? Think about when you're driving in traffic and someone cuts you off, or the traffic's not moving, or you're in a hurry and you can't go anywhere. Maybe some choice words come out of your mouth. Maybe you wish you had a drink. Maybe you wish you were at the beach because it's frustrating. That is a challenging reaction. That is an unmet need. And the individuals with brain change have unmet needs. It's food, it's thirst, it's bored, they're wet. Unmet needs. Think about every time, or pain. Think about every time your loved one shows a challenging reaction. Think about it. What time of day is it? Is it close to dinner time? Is it they're in pain and they can't tell you? Do they have a UTI that hasn't been diagnosed yet? What is the cause for the brain change? I tell you, when my blood sugar gets low, my energy goes like this, and I can feel it. When you lose your language, you can't express it. And so it comes out in challenging reactions. So next time you're in a challenging reaction, just take a minute and stop. Is it you? Are you hungry, tired, in pain? Or is it your loved one, tired, hungry, and in pain? The majority of the time, people do not just explode because they're having brain changes. There is something that causes it. Next, the individual with brain change needs to feel safe and secure. That is huge. That way their anxiety will go down. They will be able to hear and process better. So having strong relationships, making them feel and letting them know that they are safe and secure is a huge way to make this easier. The last thing I want to talk about is hospice.
Hold on, say that last sentence again, because I had moved forward.
Yeah, I don't know what I said. Just skip it. Hi, now it's time to talk about the H word. You know, that word that no one talks about. Oh, I don't want my family member in that. They won't like that. Let me tell you about hospice. That's the H word I'm talking about. Hospice is an organization that helps individuals live a better life more comfortably. That is all hospice is. You're like, no, it means someone's going to die. Usually people who enter hospice and the requirement is you have to have 6 months or less to live. But let me tell you, I've known people in hospice for a year or two. Some people actually get better while being on hospice and they come off. And then when it's time, they come back on. Why do people do well on hospice? Because they like their relationship. Their medicines are being managed. Their pain is being managed. They're feeling better about themselves. That's what hospice is. They come into your house 3 or 4 times a week, a CNA does, a certified nursing assistant, to help with bathing and changing and dressing. A nurse comes to visit you once a week. A social worker or chaplain, or in Weinstein Hospice's case, a cantor, comes by once a month to bring you support. All the other hours and times of the day, it is you and your support team. If you would do me a favor real quick, and if you would put your shoulders up to your ears like that, let me know, did any of you find that was comfortable? No one did. Yep, I didn't think it was comfortable either. If it was not comfortable for you to do this, then why would it be comfortable for your loved one to live in bed like this? Morphine is a dangerous drug. However, when you are in the last part of your life, you're not going to become addicted to morphine. Let's just be clear about that. Number 2, with morphine, you could not take enough to kill yourself or someone else. It's small doses of morphine that stay in the body for a short amount of time, and then it's gone. But it sure would be better to lay in bed like this than to lay in bed like that. And morphine actually doesn't work for everybody. It is just a tool to help your individual calm down. And then, how do you know when it's time to call hospice? When you want to give your loved one and your family the gift of time. You want to embrace those moments of joy that are still available. And you want you and your family to feel supported by an outside team. Now I'm going to turn it over to Eliza.
One thing, obviously, that's critical for hospice admission is physician's orders, right? Your primary care doctor or the neurologist, whoever has been following your loved one and has been seeing these changes, has been diagnosing them and following with you closely, will let you I think end. One thing we use is a functional assessing tool that we use. It goes from it gives us some details about how your functional capabilities are, right? So are they able to dress themselves? They don't have to do it all, right? Are they able to hold their head up? Are they able to smile? And that would obviously make them even less. So that would be in the stage 7. So in order to qualify for hospice, we look for them to be, impaired cognitively and functionally. This guide. Why should we consider hospice? As Stacy said, it can be a scary word, and why you go there? But the truth is, it's such a great and wonderful support system. It can really truly help a patient as they're transitioning to their final stages in life, as they're terminal, and dealing with issues that come with that terminal stage of life. So managing pain, right? A lot of times as the patient is now terminal, they experience and the body is shutting down, they now need help assisting with pain management, especially patients who are living at home with family members or in their own apartments. This is truly beneficial to help make sure that they're comfortable and giving them that quality of life, helping them with activities of daily living. So making sure, with hospice, we have helpers, CNAs, nurses, volunteers that will help come out and help with bathing, feeding, dressing, truly whatever the needs may be as the patient is declining and progressing, we make sure that we provide that support. The social workers, the chaplains, the nurses, not only support the patient, but they truly support the family as well. Volunteers can come and help assist, around if a family member is a primary caregiver, and we know that can be very hard and stressful. Well, maybe the volunteer can sit with the patient and the caregiver can take a little bit of a breather, a break, right? The nurses will come out and help assist as the patient's transitioning, help the family and educate them with what that looks like. What you can, a lot of times, one might not even thought about, but as your family member is declining and progressing, well, sure, you need a wheelchair, right? And a hospital bed would be a huge help. Or maybe as their, lung capacity is declining, oxygen would be helpful. And so hospice comes in and helps provide that equipment, but also helps let you know when it's time for that and helps make sure that you obtain that and secure those for your loved ones. I recently was reflecting on a case that I had, a patient with Alzheimer's. And as we know, Alzheimer's is a progressive disease. There's no cure. And while she really truly liked engaging, talking to people and having visitors, and as she started the decline, we saw that she was no longer verbal, right? She didn't make eye contact anymore, but a volunteer would come and the staff would come and sometimes read to her or talk to her. And you can see how her expression would soften. And just as Stacy said at the beginning, and to kind of tie it all in at the end, people will never forget how you make them feel through this process. And so what we at Weinstein Hospice aim to provide and what we can provide is a wonderful support.
Your questions in the either the chat or the Q&A.
So we don't have real death, which can be scary, or dying, which can be scary. But I think you can realize that they're now broaching a new stage in life. Things are becoming more difficult, and I think that's
in how you treat a dementia patient in terms of this communication piece than other ill patients, correct?
No, for me saying I'd like you to help me with this, you're trying to engage the person.
Right.
If someone without cognitive decline was not coming into hospice, the conversation would be different. You're asking the person with dementia to join you on this journey that you need it. And people with cognitive decline want to feel important.
I see. Okay. Okay. So how, beyond the transition and the communication piece, how does care for dementia hospice patients differ from non-dementia hospice patients?
So that's a great question. Um, at Weinstein, care is individualized. It'll depend on every case is different and it'll depend on the individual. But what I typically see with a lot of my dementia patients versus, let's say, cancer patients or COPD is that they require less, I would say, less pain management. They're just, typically towards the end, they'll require more pain management. They really just require to make sure that just more oversight, more making sure that their needs are being met. But they're not typically, from what I see, unless there are other comorbidities or other things going on in the picture, they're not ones that are typically suffering from a lot of pain. They're just slowly, it's a very slow progressive decline. And so we just make sure that we're giving them that support, making sure that they're well cared for while that's happening.
Okay. So go ahead.
Can I just add to that a minute?
Sure.
So I would say also with individuals that have dementia, maybe they have lost their speaking ability. So I would use a lot of cues like, hey, would you like a bottle of water, book, or something different? Giving individuals with brain change choices, A or B, is huge. You're not making it for them. You're just supporting them in doing it.
So by inviting them into the conversation about adding hospice or extra care, Sharon believes that people with dementia severe enough to qualify for hospice may not understand the difference between hospice and other care in the home. That's just a kind of a thought. Another question is, specifically, how do you know it's time for a dementia patient to transition from assisted living to hospice care? What is the key trigger? I know you said there's an assessment tool that you use, but before you call hospice, what do you see that triggers that?
Sure. And so I guess just to clarify that, someone can be in assisted living and be on hospice. They don't necessarily have to transition out of their assisted living to hospice. What I would tell you is things that we look for is, again, the assessment tool to make sure that they're no longer able to do certain things that they used to do, right? We're looking at the trend and the slow progressive decline. So how much are they able to eat, right? Is there difficulty eating? Are they able to and it is never, what Stacy said, it is never too late to try and make that call.
So dementia there's a lot of confusion out there about what is dementia and what isn't dementia and all that kind of stuff. So is there a biggest
life do you see individuals living with dementia? Number one, there is a program in Georgia called the Georgia Memory Net. It is sponsored by the state and it's funneled through Emory University, where there are 5 physical clinics where you can go for a dementia diagnosis and workup. You go for your initial appointment, and then they send you out for some tests, and then you come back for the results. And the way it ties in with the state is because once you get your diagnosis, then the Georgia Memory Clinic sends it off to the Area Agency on Aging. And the one for Atlanta is right in the middle of downtown. It's called ARC, Atlanta Regional Commission. Also, Georgia has a state Alzheimer's and related dementia plan. that is helping Georgia to become more dementia capable. And I know you think we're behind on a lot of things, and we are, but can I tell you, in the area of dementia, we are one of the states leading the way. The other thing is, it's impressive, isn't it, Richard?
It is. I'm surprised with that answer.
I know, but we are. The other thing is the state developed a dementia team this past year, and I'm the team lead for that. And one of my responsibilities has been to, I did hear resources, because they're out there. We just cannot seem to let enough people know. Like, I didn't even know what Georgia Memory Net was until I started working for the state. I'm like, you mean I can go to Grady and get a dementia diagnosis for free as long as I have a physician's orders? Yes. The University of Georgia has a great program. It's called the CARE program, where you can go to Athens and get a full diagnostic and psychological workup, as well as other tests. And they will support you on your plan along the way. And for that program, you do not need a doctor's prescription. The other thing is, hold on, let me think a minute. So we have, in our Georgia state plan, we have 6 volunteer groups that are helping make policy for the state of Georgia. And if you are interested in joining a work group, please reach out to me. It's a once a month commitment for 1 hour a month. But we are always looking to get new volunteers, and especially individuals that are care partners. And
Yes.
They mostly live under the medical model. But when you give individuals with dementia, in the community. The other type of training, if you want to learn skills on how to help someone with dementia, is positive approach to care. Teepa Snow runs that program. What I like about it is, first of all, she speaks plain English. It makes perfect sense. The skills are simple. Like, for example, giving someone space before you go into their space, letting them see you first. Hi, I'm Stacy. And then reaching out your hand. If they do not reach back, what does that mean? They don't want your touch.
Yeah.
So you respect their space. It's about stepping to the side of them and not blocking their view, because as you get them, as dementia progresses, your vision changes. And if all I can see in front of you is a person, I might be scared. So Teepa teaches a lot of practical skills.
Okay. And in addition to that, Jewish Home Life uses the I'm Still Here approach to dementia care and engagement at Berman Commons, in Dunwoody, and at the William Bremen Jewish Home as well. So that's another approach that is available for people that are interested in volunteering or counselor perspective, etc. Stacy, do you find that there are behavior differences between the different types of dementia diagnoses?
Absolutely. You know, totally not acting the way they used to. Really big notices in behavior. And in that case, it's important to find out what type of dementia you have so there can be support. So you as a care partner can support your loved one in the correct way, because the different types of dementia also requires different caregiving.
Are there any other questions coming up from the attendees for our esteemed panel here? Okay. If not, both of our experts are available afterwards from we'll show the last slide and show you how to access Weinstein Hospice for questions, and we'll get the questions to them. So last slide, there's my thing. Questions about Weinstein Hospice or Palliative Care is a phone number, and www.weinsteinhospice.org. Here's Stacy's email address as well. And if you enjoyed this one, please mark your calendar for our next conversation, which is going to be in January. And it's about death and taxes. You can't avoid them, but you can make it easier on you and your loved ones by following certain steps. And that's what we're going to be talking about then. So thank everyone for coming tonight and being here, and we're going to let everybody go. Thank you.
Thank you.